Dr. Ayisha Livingstone. I'm with Orthopedics. I wanted to give you guys a brief explanation and presentation on something I commonly treat. It is called carpal tunnel syndrome. Many of you have either heard of it, have had it, have relatives or friends who have had it. It is probably in one of the top 5 things that I treat. To be brief, it's essentially a compressive nerve disorder. The problem is the nerves that live in the center of our hand, in your carpal tunnel, they're under a lot of pressure on a regular basis. That tunnel also houses all of the tendons that bend the fingers. Anytime there's increased pressure in the tendon, the nerve can act abnormally. Ways a nerve can present with abnormal function are loss of sensation, pain, numbness, tingling, cramping to the muscles that nerve affects. This nerve is called the median nerve. It is the only nerve that lives within the carpal tunnel. It provides sensation to the thumb, the index finger, the middle finger, and the radial half of the ring finger. It is not a theoretical tunnel, it is a true tunnel. For example, you can see the nerve here in the yellow. The tendons would be these thinner structures that are also living in the tunnel. They would allow you to flex your fingers. The ligament that crosses the palm of the hand is called the transverse carpal ligament. It is a structure that is placing that downward pressure on the nerve. Those forces are increased anytime your hand or wrist is in a flexed position for a longer period of time, which is typically why I'll have patients see me and say that, "Doc, I don't know why my symptoms are worse at nighttime." If you think about how you sleep, a lot of times we curl up on our sides, we curl on our stomachs. Anytime the wrist is flexed for a prolonged period of time, it increases the forces in the tunnel. Also, a lot of people think it's secondary to computer use. It is mostly the position of your hands when you're at the computer. Unless your workstation is very ergonomic, your wrists are going to be placed in a flexed position while you're typing. One thing you can do is extend your wrists with a small pad. You can wear wrist splints to type, and also wear wrist splints at nighttime. That's usually the first step we'll try when we're talking about carpal tunnel syndrome. When symptoms get more aggressive and people come to see me, other options to treat it are therapy, steroid injections into the tunnel, and oral anti-inflammatories. All of those may be simple temporary measures unless your symptoms are very early and mild. When I feel the symptoms are getting too aggressive and I'm worried about nerve damage over time, I typically will recommend you see a neurologist for something called a nerve study. That gives me a lot of valuable information onto the nerve function. If I don't feel that the nerve is functioning properly, I usually will recommend more aggressive and definitive treatment, and that is called a carpal tunnel release. Stay tuned for another presentation on the carpal tunnel release, both the open and endoscopic approaches. Thanks for joining me. Bye.